Oh, good morning. I'm Martin Rossor from Queen Square in London, and this is Dr. Joel Kramer from UCSF. And Joel, first of all, congratulations on a really very nice study. And
thank you very much.
perhaps just give us a brief background to that.
So age-associated cognitive decline is a fairly widespread phenomenon. My bias is that there are multiple biological factors that influence cognitive aging, so that while many folks have subtle signs of neurodegenerative disease and vascular disease, there are multiple other biological mechanisms that influence the degree to which someone is going to show some age-related cognitive decline. So one of the areas that we've been particularly interested in is the role of neuroinflammation. And as we get older, our ability to mount an inflammatory response is normal, but our ability to diminish that over time decreases, so that chronic neuroinflammation is more widespread than we think. And we know from animal models that chronic neuroinflammation can disrupt neural functioning, hippocampal functioning, and endothelial functioning. So we're very much interested in looking at the role of inflammation and its impact on cognitive functioning. We have baseline data that shows that chronic neuroinflammation may be associated with smaller medial temporal volumes and poor memory consolidation. In this particular study, we were interested in looking at the effect of baseline inflammatory markers and its impact on longitudinal change in executive functioning.
So can I ask, you using CRP here, so do you see that as a surrogate for neuroinflammation, or just that there may be some other factor other than purely inflammation that's reflecting systemic ill health?
Okay. So this is a fairly healthy cohort. So our assumption is that CRP is a reasonable marker for some longer-term inflammation. We're also interested in looking at some shorter-term inflammatory markers, things that, like TNF-alpha, for example, or the interleukins.
And this was measurement at baseline or at point zero, and then you measured their function, including particularly executive function, at 1 year? Is that right?
The follow-up was around 20 months later.
About 20 months.
Mm-hmm.
So was there any sense that when this smaller subgroup with raised CRP had an acute inflammatory or systemic illness, or do you surmise or have any data that suggests that this is a chronic systemic low-grade inflammation, like sort of poor dental health or whatever?
Right. So we now ask everybody if they've been ill, in the month prior to their assessment. We have a couple of cases who had extremely elevated CRP, and our assumption there is that they had some acute illness that caused some temporary blip in their CRP. But when we used the data, we simply said, did they have any level of detectable CRP or indetectable levels of CRP? So the one or two cases that had extreme elevations really didn't influence the data very much.
I mean, what I particularly liked about this study is it got us away a little bit from always thinking about Alzheimer's disease or vascular disease or whatever, and because poor cognitive health is just so common in all sorts of systemic disorders. But I guess the question is, how many of these do you think you might follow through to autopsy and ask the question, what might be some of the neuropathological correlates of what you're observing?
That's a great question. So most everyone in our cohort, we have a cohort of over 100 normals who've signed up for autopsy and are part of our Alzheimer's Disease Research Center at UCSF. So they get followed every year and will be followed until autopsy. But when they go to autopsy, it's a separate question because they may be around for decades.
Yeah. And you're adding some other inflammatory markers, more fine-grained assessments, I believe.
Correct. In fact, what we're interested in is some of the genes that regulate inflammatory markers like IL-1, IL-6. We're including TNF-alpha, the interleukins, and even looking at progranulin, which will be particularly interesting for us because we also follow some families with progranulin mutations.
That would be very interesting. Mm-hmm. So again, congratulations, Joel.
All right.
Very nice study.
Thank you very much.